these different things. And in the homework folder, I will put rotating things, and this is where you can post your recent stuff. So you can start putting your drawings of hands in this folder, in the homework folder. So in the image library,
No. Oh.
in this folder, anatomy reference, there will be stuff that I start to put in here. There's already a lot of stuff in here. Bames is the name of one author of an anatomy book, a German anatomy book. You may recognize some of these plates. Straturuomo is an Italian anatomy book, which is very helpful with simple construction schematics. And there's quite a lot here. That is an 8-head cannon. Rachet Bones is where we'll sort of begin to focus our focus, which is on the skeleton. So these plates, I'll talk about a little bit more, but these are, I think, the ones to use if you were to draw the skeleton, to do diagrams and label bones and so forth. But this one with terminology is the one we will be in today. And we'll just go through basically the axial skeleton and the terminology, some general terminology, and then terminology specifically to the axial skeleton as an introduction. So I thought it'd be helpful to do this from the outset so you can get a sense of how you pronounce some of these names, and if you want to ask questions about anything, we can start there. But this plate right here, this first plate, and I kind of have these in an order that I hope is helpful. Basically, some general terminology, and then terminology of the skull, and then from the skull to the vertebrae, and then to the thoracic cage, the thorax, and then the pelvis. And that is the axial skeleton. So there's a few more things on there already, and I'll be posting more on there, but we'll just talk about the axial skeleton today. So we could, in this setting, if you guys would like, we could unmute everybody unless you have, background noise or something you want to cover up. Because I want to go through some of this terminology, but I want you to be able to stop me at any point and ask questions. So I'll just start with this first page. So this is like the directional terminology for the body, which is also useful in other contexts as well. If you look to the left of the page, and Andrew, do you see any of this with? Well, you could log in, or you could just come here and look off my screen. Yeah, this is on Google Drive. Okay, so as you move away from the center of the body, that is a lateral move. So you're moving laterally. So anything basically moving to the sides of the body is lateral, and moving to the center of the body is medial. So that's what it means up at the top. when I move my cursor, can you see my cursor or not?
Yeah, we can.
Okay. And then superior, inferior is higher or lower. Anterior, posterior would be front or back. Proximal means more close, and distal more far away or distant. So we are doing distal learning right now, and we hope to do proximal learning soon. Now, with the hands and the feet, you notice dorsal and palmar. Palmar and dorsal are adjectives that have to do. Dorsal typically means the back, like the dorsal fin of your favorite dolphin. But it also references the back side of something. So the back side of your hand is the dorsal side, or in the case of the foot, the dorsal side is the top of your foot. And the bottom of your foot is the plantar side, and the front of your palm is the palmar side. So, by the way, what we're looking at, this pose is called reference pose. And it's called reference pose because basically it's important for this terminology that in this pose, the things that are facing forward are anterior, and the things that are facing backwards are posterior. So all this terminology is based off of this sort of point zero for position for the body, which is called reference pose. And by the way, getting into comparative anatomy, when you look at the terminology for animal anatomy, for example, it is derivative of human anatomy. So, of course, the animal has a horizontal vertebrae, which means in reference pose, it's superior on the human spine is not going to be superior on the animal spine necessarily. And so that does change like the orientation of superior, inferior, or anterior, posterior, front and back when you change the direction of the vertebrae. But the terminology is still derivative of a vertical, the vertical design of the human body. Okay, so you see on the right side this little diagram with 8 directions on it. You have posterior, anterior. If we're looking from the bird's eye view from above, that would be, by the way, the superior view if you're looking from above something. And so we have this superior view of the diagram, and the object is facing downwards. So anterior is the bottom of the diagram, and posterior the top. So you have medial. What they should have done in this diagram actually is have this a half circle rather than a full circle in that square. And the half circle should, the middle of the circle should be at where medial is, because medial is really the center. It's not left or right, it's towards the center. And lateral. So when you're moving obliquely on a 45-degree angle, you just have a blend of those terms: anteromedial, anterolateral, posterolateral, and posteromedial. So if you know posterior, anterior, lateral, and medial, you'll know how to combine them, or you'll at least recognize them when they're combined and what they mean. And these, it's important to know these terms right off because they will be used repeatedly throughout the body in naming different anatomical parts. Another thing that is often used is superficial and deep. And often deep, we often learn the Latin name for muscles and so forth. And so deep would be profundus. So profound or deep and superficial would be 2 terms that get used a lot. Any questions on this page?
No, looks good.
I don't know if your resolution is good enough to see the text of this. Maybe I'll zoom up a little bit. So we just talked about the reference pose. And that feedback. We covered some of these. Anterior is sometimes, so ventral is opposite of dorsal. Ventral means belly. So typically that's the front side and dorsal the back side. But again, we don't always think of the top of the foot as the back side of the foot, do we? I don't know, but that is the dorsal side. Cranial is sometimes used instead of superior, and caudal instead of inferior, and that's usually in referencing the spine, because caudal means tail in Greek or Latin, I can't remember which. So basically towards the head or towards the tail with a vertical vertebrae means superior or inferior. So you will see, in fact, we'll use caudal in terminology like cephalocaudal means head to tail, and that's a term we'll use with growth and stuff. Median means in the middle of or on the midline of something. Medial towards the midline, and lateral moving away from midline. So internal is synonymous with deep. External is, again, like superficial. Oops. Oh. Proximal is in close proximity. That usually means towards the trunk, and distal means further from. Deep. And by the way, typically when we talk about muscles, there's the origin and the insertion, and the origin is usually what is closest to the trunk or the proximal end of the muscle. And the insertion, the idea is that you're originating from the trunk and you're reaching outward to the extremities. So the insertion end of muscles would be the distal end. Deep, away from the surface or covered by other structures. Superficial, towards the surface. Subcutaneous, you have to say that a few times in your brain, so when you see the word, it feels natural to your mind. Subcutaneous. Subcutaneous means just below the skin, and sometimes we use that just to reference bony landmarks. So if we say a subcutaneous point or landmark, it's usually referencing like some bony landmark that is surfacing to the level of the skin.
So would that be like your ankle or your wrist?
Yeah. So the distal end of your ulna is that bony end on your wrist that is on the side of your pinky. So that bony point on the side of your pinky is a subcutaneous landmark, because that's, so in drawing and painting or sculpture or whatever, when you're depicting the body, those bony landmarks are really important to treat a little differently, so that they read differently than soft tissue. Especially when you're abbreviating, like in drawing, abbreviating the figure. Those are important little cues to the construction of the figure. So the greater and lesser adjectives are always helpful because things tend to be interrelated in the body, and you have parts that are versions of each other. And so often we use the terms major and minor to describe that. So almost always when there's something, there's a major something, there's a minor something. Palmar or volar means the palm, plantar, the sole of the foot. Okay. Any questions on that? Nope. So this is just a real simple diagram to think about the terms in how volumes are related to each other. Tilted means basically the axis is things are moving on an axis on the lateral side. So the side of your thorax is moving towards the side of your pelvis, like as is diagrammed there, tilted, like contrapposto. Tipped is where on what I don't have here are the different planes, the coronal plane. I'll pull up a diagram after this of the three axes or planes. Rotated is where things are, we also use the term twisted, where things are rotating on the y-axis, and combination, which is where we get spiraling movements in the body that Michelangelo is famous for. So different kinds of edges: blunt, pronounced, and sharp. Different definition, different levels of definition of forms. So if forms are deeper, that's called high relief versus low relief, where things are flatter. And where forms merge or come together, either it's a soft merging or a more sharp coming together of two convex shapes. Typically on the surface, at least, that means there's more adipose tissue or fat, as my kids call it when they're talking about their dad. So that tends to round the forms, and you lose the definition between muscles and other landmarks. Surfaces, when there's no curvature so a surface is essentially two-dimensional when there's no curvature, and it's straight in either direction. When you have a cylindrical shape, like on the side of a cylinder, you have straight on one axis and rounded on the other. That's called convex straight, or concave straight, which is not diagrammed here. Convex convex or concave concave would be where both axes have curvature. Convex concave, where that's like the inside of a donut, or the outside of a donut, I guess. That we will find shapes like that, especially where joints meet, for example, at the wrist. Sometimes that's called a saddle joint. And concave, so here are some examples with the torso of extension and flexion. Flexion is basically contraction, so where things come together. Flexion or extension is where things expand. So extension, where it says extension, it's referencing the front side of the body, but it would be flexion on the back side of the body. So there's always this complementarity with the body. On one side, if one side is in flexion, the other side is in extension. Erect suggests neutrality. So lateral bending, which is called tilting. And that little diagram is just how the rib cage changes when you breathe. Okay. So you have in the body, well, in the appendicular skeleton, you have long bones and short bones. And that's kind of self-evident. We'll get into the axial skeleton later. So you also have this issue of mountains and valleys on the body. So when you have convexities, which would be mountains, or little nodules, sometimes they're called tubercles or tuberosities. And the largest would be called condyles. And when you have concavities or holes or divots, those are fossa, or if it's like a crack, it's a fissure. And a foramen would be typically a larger hole than a fossa. So fossa and foramen would be holes or divots, and bumps would be tuberosities or tubercles, or the largest would be condyles. A protuberance is typically like less just like a smoother convexity rather than like a distinct bump. So your forehead, in the back of your head, for example, is well, if it's very rounded, it's sometimes called an eminence, but a protuberance would be like a small version of an eminence, which is just a rounded form. With a diagram of the pelvis, you see fossa pointing to somewhere blank, but it should be pointing to a little hole or a little divot. Crest, it references this ridge that goes along the top of a form. Okay, so now we'll start getting into the specifics of each anatomical part, starting with the skull. Like we've emphasized before, it has two major parts, the face and the cranium, the facial part and the cranial part. And here you see it divided into those two parts, the cranial bones. You have the frontal bone, sometimes called the frontal eminence. You have the parietal bone. Parietal, I think, means the side. So if we saw a view from above, let's see. Well, a view from the back, you see there's a left and right parietal bone with a little suture in between that goes down the center. The occipital bone would be where the cranium meets the neck, the backside of the cranium. You notice that the shape of the cranium here is sort of tilted upward on the front side and downward on the back side. We'll talk about that from a interpretive standpoint and symbolic standpoint. But that's important to remember, that you basically have two spheres like an egg shape that compose the larger cranium, and the smaller sphere is the front side and is raised up higher than the lower sphere.
So, if I can ask a question, does our skull actually have those seams, like, all the time?
If you look close at mine, you might know. Actually, yes. So when you're an infant, those are plates that have yet to merge, and there's just cartilage between those plates. And then those seams that you see are called sutures, and as those plates grow together, they form those sutures like little rivulets between these bones. So yes, just how it's diagrammed here is how your skull is right at this moment.
Okay, that's cool.
The temporal bone is, the bone that is adjacent to your ear. And you see it has a little arm that reaches out, which is part of the zygomatic arch. And it is the zygomatic, and we've mentioned this before, that is the link between the cranial bones and the facial bones. The sphenoid bone is the bone just medial of the zygomatic arch. The lacrimal bone, lacrimal means tear. So it's this, you have, let's see, well, we'll show that in more specificity later. The nasal bone is basically the bridge of your nose. The maxilla is basically your upper muzzle, and the mandible is your jaw. So here's just a different diagram coloring the different bones differently. So you see the sutures separate the temporal from the frontal and parietal, etc. The occipital. So here's a detail of the mandible. You have the main body of the mandible. Where the mandible changes angle, that's called the mandibular angle, or the angle of the jaw. The ramus of the mandible, ramus I think means like ridge, because that's a term that references other ridges in other bones. The ramus of the mandible. The mandibular condyle, again, a condyle is like a larger tubercle. So that's where the jaw articulates with the skull. The mandibular notch is this concave ridge here. Oh, I didn't mention process. Process is also a reference to some convexity, some growth or bump. So the coronoid process is the front. You have these two articulating surfaces of the jaw. The anterior facet or face is the coronoid process, and the posterior is the mandibular condyle. So you have a number of mandibular things like the mandibular foramen or foramen. Again, a foramen is a larger fossa, like a larger hole. The mylohyoid line is pretty insignificant to most of what we do. The alveolar process is on the front, basically on the chin area. The mental protuberance is a key landmark. That's sort of the high point of the chin, or the bony landmark of the chin. And mental references the chin, basically. The mental foramen is this little hole here. So, so this is the maxilla here, and the zygomatic process is basically this is where the zygomatic arch connects to the cheekbone, where it grows into basically the cheekbone, and the alveolar process. You have, remember, we have those both on the mandible and the maxilla. Those are basically these ridges where the roots of your teeth are underneath. Infra means inferior, so infraorbital foramen is this hole that is below the orbital bone of the skull. By the way, foramen, you'll find that some of these words are pronounced differently, and I have talked with doctors who say that artists say it wrong, but I've heard doctors say it differently, and so a lot of these terms you'll find the emphasis sometimes on a different syllable. I used to say foramen, and then I started to see there's more of a, because that's how I learned it, but then I started seeing in the medical world it's more of a consensus on foramen. So now I'm trying to learn to say foramen instead of foramen. So whatever you guys, whichever path you take is up to you, but there are quite a number of terms that tend to be pronounced differently depending on who pronounces it. And obviously these are derivative of Latin or even Greek names, and so sometimes just in those transliterations, the English would have you emphasize one syllable. So it kind of depends, I guess, on how anglicized a word is sometimes. But anyway, this is a cross section. So we're looking at the facial bones as if they've been cut down to the center. So you see the sinus, the sphenoidal sinus canal. And you see these nasal conchas, superior, middle, and inferior. The ethmoid bone we'll look at from a different angle. So that's called a medial view because you're looking from the center. So I don't want to get too, these are like all the little parts of the skull, and some of these are interior bones of the skull. And I do want you to study these, but I want to just go through, here's basically just a basic diagram of the skull and the brain cavity of the skull. You see from the section view, three basic concavities there that fit the brain, anterior, middle, and posterior. And from above, you see what those little concavities look like from above. So again, a lot of these same terms, but just from the anterior view. So the way I would suggest that you commit these to memory is to draw and label the bones from the anterior view and lateral view, at least. If not, sometimes with the skull, I would do anterior, lateral, superior, and posterior views. So front, side, top, and back. And the way I would do that is, I don't want you to spend a lot of time drawing it. So I think it's best, for the sake of repetition, to draw it quickly and then label each one. Try to commit it to memory by repeating it a few times. Try to repeat it without looking, and go back and forth. And the skill to memorize is something that, like any other muscle, gets more adept as you practice, and you'll find you'll memorize. Memorization will become easier and easier as you do more and more of it. A strategy for drawing things quickly, I would take these plates that are in this folder, Rachet Bones, and either do a light trace or simply mark some key landmarks and then spend some time sketching it. You'll remember the shape a little better if you draw it by eye, but you'll end up if you spend a lot of time measuring, then you will not have enough time to memorize. So you can either mark some little landmarks that are enough so you're not thinking too much about proportion, you're just thinking about the shape, and then draw it by hand, or even just lightly trace it and then just reassert those lines by eye. Or another way to do it that you did in grade school, when you have like an anterior posterior view, trace one half and then draw the other half. But however you do it, I would try to spend just like 5 or 10 minutes on the drawing part, and then spend double that on memorizing terms, and then put it away, and then revisit it the same day and try to review and commit it to memory. If you do that 3 times a day, you don't have to spend a lot of time repeating. Repeat it a few times, put it away, get it back out, try again. After you sort of rebooted your brain 3 times, you should start to, it should start to fit into your memory bank a little better. But then after that, review it daily. And in a couple weeks, everything will be pretty familiar. So in order to do that, you can't spend a lot of time drawing, and you can't spend a lot of time with stewing over each term. So just try to use the principle of repetition more than anything.
Sure. Do you want us to know all the little skull bones and stuff, or just the?
So what I would say is, let's see. I think I didn't post the Rachet plate. So these Rachet plates are pretty basic. They don't have every nodule labeled. So I would say I'm gonna have to put on, I think if you have like these 3 plates memorized, that will be plenty. What they don't have, no, that'll be enough. So like for the skull, that degree of specificity on the skull. But if you start out more basic, like this right here, you'll want to know a little more specifics than this, but this is pretty specific, and you'll get pretty far just by knowing those many terms of the skull. So you can see this is a little more basic. I would probably keep at this level until you have the rest of the bones memorized. The skull has a lot of these little terms, and you can get lost, especially as you get inside the skull with all those terms. So maybe just get familiar with these terms on this illustration and this one, those two, and then move on to the rest of the skeleton. And then we're going to be getting into each body part more deeply, and maybe that's when you get into all these terms. A lot of these terms aren't committed to my memory. They don't have much. If they're on the inside of the skull, they don't have much reference to surface anatomy and myology, which is the muscular side of things. And so usually I only know those terms if they matter to the larger ideas of the body, as far as I have learned them. So yeah, I would just keep it basic for now, and we will go more in depth as we do écorché and stuff. So these two plates would be sufficient for the skull for now. With the vertebrae, you have basically three sections of the vertebrae. Vertebra is the singular name for a spinal bone, and vertebrae would be the plural form of the word. So each vertebra of the upper region of the vertebrae would be the upper region is the cervical region. There's 7 vertebrae and 7 cervical vertebrae. Cervix means like a neck, so thus these are the bones of the neck. The dorsal region, and sometimes called the thoracic region of the vertebrae, would be those vertebrae that articulate with the ribs or with the thorax. And the lumbar region has 5. So there's 7 cervical vertebrae, 12 thoracic vertebrae, and 5 lumbar vertebrae, each important numbers. And you see the lateral view, this middle diagram, has each one numbered. So it'll be important to know how many of each section. We often, just in basic anatomy reference, C7. So often in shorthand, we just call these C1, C2, C3, C4, C5, C6, C7, and the thoracic vertebrae would be T1, T2, and so forth, and the lumbar vertebrae would be L1, L2, and so forth. Okay, questions on that? The sacrum is basically fused vertebrae that are an inseparable one. And so the sacrum is considered to have 5 false vertebrae, or they're false in the sense that they don't articulate, they're totally fused. The coccyx is your little tailbone right at the end. And it also is considered to have 4 false vertebrae. So that would be 9 false vertebrae at the caudal end of your vertebral column. So this plate shows a vertebra from each of the 3 sections of your vertebral column. So you're going to want to become very familiar with what a posterior aspect is, lateral aspect, anterior aspect, because we'll be using those all the time. Of course, it's very essentially parallel to when we're looking at architectural drawings and schematics. The front elevation would be the anterior aspect. The side elevation would be the lateral aspect, and so forth. And these Rachet drawings are really accurate, as accurate as are out there, I believe. Paul Rachet was a 19th century French artist. He was trained both as an artist and as a doctor. And so he devoted much of his life. He was a sculptor, but devoted a lot of his life to researching the human body. But his drawings are super accurate, and they're essentially like orthographic views. So perspective is very minimal, and so you don't get distortion. And if you were to rotate these in space, the measurements, whether you're seeing things from the front or the back, they should be the same. Anyway, so this top illustration, or set of 4 illustrations, are the 4th cervical vertebra, and the middle is a thoracic vertebra or dorsal vertebra, and the lower is lumbar. And if you compare the 3, one thing that's very distinct about the dorsal vertebrae or the thoracic vertebrae is that they have this little notch right here, which is a costal facet, which means the face that the rib articulates with. So the rib will come in and connect right here, and the next rib down will connect right here. So each one of the vertebrae has partially articulates. In other words, if you remember what I said in my last lecture about every part has a shared member. So this vertebra has this place of articulation that it shares with the vertebra above it, as they both articulate with the same rib. And so this lower facet is the part that articulates with the next rib down, and that rib articulates with the vertebra below this one, if that makes sense. But they both, these thoracic vertebrae are unique because they have these facets. You won't see those on the cervical vertebrae or the lumbar vertebrae. So instead of having ribs coming out of the lumbar vertebrae, they have these wider wings. So that's something that's typical of the lumbar vertebrae, is they have these longer transverse processes. Oops. It looks like in this diagram that the transverse process is longer, but it's really not. We'll look at that more later. It's really just a question of scale. So the spinous process is basically this, the point that is subcutaneous that you can feel, that we recognize as the spine from the surface. The middle, the hole down the middle of each vertebra is the foramen, the vertebral foramen. Okay, this plate illustrates two different cervical vertebrae, the atlas and the axis, and they're both, they're a very important couple and sort of the royalty of the vertebral column. And they work together in an amazing way, and I call them a couple because they have sort of a feminine and masculine aspect to them. I think I have some illustrations later that show how they interact. But also on this plate, you have the sacrum and the coccyx. So I would commit to memory everything you see on these Rachet plates. These plates should have, they have a little more specificity. Yeah, so if you're cruising with your terminology, maybe you learn these too, but they will be sort of the secondary terms we'll learn later. And some of them we probably will just breeze by without spending a lot of time on them. Okay, so the thoracic cage, I'm going to try to wrap up here in about 10 or 15 minutes or so. So we're just going to go through the thoracic cage and then the pelvis, and then we'll finish. Sort of thorax, you have of course the ribs, and often costa or costal is referencing the rib. So the cartilage that connects the rib to the sternum is called costal cartilage. Things in between two ribs, like there's muscles in between the two ribs that are intercostal. You have 7 ribs that have this costal cartilage. And I guess I should say costal cartilage. Sometimes it's more Latin correct to say costal and more English correct to say costal, but you'll usually hear it costal. So the costal cartilage, the first 7 ribs connect directly to the sternum. And then you have 3 ribs below that, 8, 9, and 10, that sort of merge together and just have one cartilage that connects them. So those are called asternal ribs, 8, 9, and 10. And the sternal ribs are 1 through 7 because they connect directly to the sternum. And then you have the 2 floating ribs. Sometimes they're called false ribs because they don't connect at all to the sternum. So they only have one place of skeletal side with the vertebrae. here we see the posterior view. It's important to recognize and take note of the angle of the ribs. See how that little ridge, how each rib has a similarity with other ribs in this little tubercle of the angle of the ribs, and it's on a slight curvature as it moves down the thorax. And we won't spend any time with ligaments yet. So this is a good plate to memorize, and I have in that other folder of the Rachet Bones plates that just have both the top side of this page and the bottom side. So I would do a drawing of this and then label it just the way it's labeled here. So the sternum is like a necktie. The head of the sternum is called the manubrium. And this little seam right here is the division between the manubrium and the gladiolus, which is like the lower portion of the sternum. Where they meet is called the sternal angle. The very top of the manubrium, this little notch right here, is where the pit of the neck is, or the sternal notch, or as it's called here, the jugular notch. You see these little notches right on the side of the gladiolus. Those are called costal facets. They're facets because they're these little faces that articulate with the sternal, or with the costal cartilage. And this dotted line is indicating the xiphoid process. So there's three main pieces of the sternum. The xiphoid process looks like it's metaphysical, but it's actually not. We'll see another diagram of it. It is bony. Here is a diagram of a rib, of the sixth rib. The sixth rib is not the largest rib. The eighth rib is I guess it's not necessarily the largest, but it is the widest rib of the rib cage. So you see in the terminology of the rib, it is its own body that has a head, a neck, and a main body. So the head is the posterior side of the rib where it articulates with the vertebra. And then you have this little section right here that narrows, which is the neck of the rib. And then you have this little tubercle here, or tuberosity of the rib. And then, as it shows on this, this is actually the inferior view of the rib. I just noticed that these are all English labels except for this one right here, the plan inferior. So that's the inferior aspect. So the view from below, we see this this costal groove here and this ridge from below that the muscle's attached to. Anyway, this wider part right here where it changes angle most sharply, that's the angle of the rib. Okay, so this is just some basic terminology that we went over. So now we're at the pelvis. Any questions up till now?
I have a question.
Yeah.
When you and Nikki were doing that lecture up in Salt Lake City, you were talking about landmarks, you know, that you look for, and
Yeah.
they seem to come in pairs. And so as you're going through these, maybe just point out that yeah, this is one of them, and this is one of them, or something like that.
Okay.
I don't know. You could do that later. I don't know whenever.
Yeah, we will do that later, but maybe just real briefly. You know, so with the rib cage, one of the landmarks that, you know, we call those constellations because they are points in space that move together and work as a sort of as a unified whole. So you have this upside down Y that is the sternum and the arch of the rib cage down to the 10th rib. Michelangelo has a very specific way, well, not always, but sometimes he will define the 10th rib in a way that it contrasts with the eighth rib. And the 9th rib is sort of like sort of the mediator between these two made more distinct shapes on the surface that are the ends of the rib. So the 8th and the 10th become very distinctly described very often from the surface. But so you have the sternal notch, which is basically a landmark that can group horizontally or vertically. So to group vertically, it can group with the opening of the rib cage and the xiphoid process. The xiphoid becomes more distinct when the lungs are filled with air. Otherwise, Nikki talked about that in that workshop about the Gothic arch versus the Roman arch. As often those are two different ways to describe the arch of the rib cage, but they also can suggest whether or not the body is full of air or not. But basically you have that's a major point right there, and then the end of the rib cage right here on the 10th rib on either side. So those come in pairs, and they would travel. They would always be symmetrical along the medial line of the torso. The infraclavicular fossa is that fossa, that notch below the collarbone that we don't see, but is often tied with the sternal notch in terms of a constellation. So, of course, with the pelvis, we have the ACES, which is a very prominent subcutaneous landmark because the edge of the iliac crest is always very distinct on the surface, that front point of the pelvis. So if you look at the pelvis, let's look at the side view. You have the pubis, the pubic bone, and the pubic symphysis, or as it's called here, the symphysis pubis, is this cartilage that merges the two hip bones together right here at the center. So the pubic bone comes together at the pubic symphysis, and the symphysis means like a symphony, like the coming together. So the ischium is these the lower portion of the pelvis. Basically, what you're sitting on right now is your ischium. So the iliac crest, well, the ilium would be what we think of first when we think of the pelvis, which is this large upper portion of the hip bone. And so that larger plane is the ilium, and the top of that plane is called the iliac crest. And that is really critical to landmarks, both on the front, on the anterior view and posterior view. From behind, this is the these three. Well, so this tuberosity right here, this labeled iliac tuberosity, is part of the sacral triangle that you see when you're just looking at the morphology of the body or the surface of the body, that you have these little fosses or indentations right here, and that makes up the iliac or the sacral triangle. So so where the femur connects, this is called the acetabulum. So the acetabulum is this concavity, this deep concavity right here, that the femur, where the femur articulates with the pelvis. This is the female pelvis. In contrast to the male pelvis, you see how different the shape is. If you're just looking at a skeleton, it's not always easy to tell if it's a male or female, but the pelvis is sort of the giveaway, because the female pelvis is wider in shape and often slightly shorter or not as tall vertically. So I would just focus on the terminology in these Rachet plates. Here you see the hip bone, just the right hip bone from different angles, including the superior view. So notice this superior view here, the front, it's facing towards the front. The front is to the right, I guess I should say. So this right here is the ASIS, and it's the wide point of the pelvis. I don't think Rachet gives us a top view of the pelvis in its entirety. So you have to just look at the top view with this one side of the right hip bone. But so it's not super clear which direction this is facing, but this is the front side right here. The right side is the front side. So you can see that the wide point it's actually, I guess, a little bit at an angle. The wide point is right here of the hip bone. That would be the widest point of the pelvis. And then it comes in slightly to the ASIS, which is the furthest, the most anterior point with the pubis. So the pubis and the ASIS are basically on the same plane, are equally anterior. the hyoid bone sometimes gets neglected. We'll talk more about the hyoid bone, but it is a free-floating bone. It doesn't articulate with any other bones. It just is connected with ligaments and soft tissue. But you have what are called the greater and lesser horns of the hyoid bone, and then the main body. So what you could do is trace this this plate, and I wouldn't necessarily try to draw every rib, but just sort of indicate the spacing. But the labeling of these three plates, the anterior view, posterior view, and lateral view, those would be three good plates to draw and label. So you can see it's pretty, the terminology for the skull on these plates is pretty simple. I would commit to memory, though, I guess, this much of the pelvis. So on these pelvis plates, I would commit to memory as much as is on these pelvis plates. Okay, so that's all I intended to cover today, just to kind of introduce the terminology and to verbalize it so you could hear it. Was that helpful?
Yeah, that was super helpful.
Yep, I liked it.
Yes, thank you, Joseph. That was great.
Yeah, that was, thank you.
So what I'd like you to do is do those drawings. So again, the axial skeleton would be the vertebral column, the skull, the thorax, and the pelvis. And do quick drawings of those, label them, try to commit them to memory, and post them in that folder that says, oops, that says homework. I'll put that folder here. Called skeleton. So if you can put your hand drawings in that folder and your skeletal drawings in this folder. If you can have some drawings of the skeleton in there by next, like a week from today, that'd be great. Does that work?
Yeah, and then when was the hand drawings? That's by Tuesday, right?
Yeah,
Okay.
yeah.
Hey, Joseph, tell us again which skeleton drawings are the most, I guess, highest priority for us to draw.
Yeah, okay. So if you come in here to the anatomy reference, this folder that's called Rachet Bones doesn't have the labels on it. For the most part, they're not labeled, but they're good ones to use to trace. I've corrected them so they all match perfectly from different views, and so they're all proportional and everything. So they're good ones to use for your drawings. So if you did like this one plate, I would probably do it each view on a different page. Or yeah, I don't know. I would probably do that. Maybe you don't have to, but just so you have room to label things. And then so if you did this plate, well, maybe what you should do is just do separate plates for each part. So you could do this plate for the skull and then label it. Do this plate for the rib cage and label it. Do this plate for the pelvis and label it. And then this plate for the vertebrae.
And we're kind of using our own methods, whatever works for memorizing, right? Like if we're
Yeah,
seeing
yeah. However works best to memorize and however works best to draw it out quickly. Sometimes you remember better if you spend a little more time drawing it, but I would not spend the kind of time you've spent on the drawing plates. You know, just get it in there so you can label it. So I would also do this plate. So the plate of the sternum, the vertebral column, the rib cage, the pelvis, and the skull. I'll do those 5 plates. So I guess, I mean, if you would like, you could just do these 3 views instead. Whatever you'd like to do.
So Joseph, we're probably doing this on 8.5 by 11 paper and scanning it into our computer, I'm guessing. And then should we just label our name in the top right corner or top left corner or whatever?
Yeah, so if you could just put your name on it, and it doesn't have to be a perfect scan, however is least embarrassing for you to post it. You know, if you just want to take a picture with your phone, that's probably clear enough. Yeah, just so we can see what it is.
Yeah, I was just gonna do a compilation of them in my sketchbook and then take pictures.
Yeah, that's totally fine. You know, like with these different plates, you don't have to have every view on the same page. You don't have to like place it the way it is placed on this plate. You can just sketch it in however is easiest and start to label. The Straturomo one, you may want to look at some of these. You can certainly copy these. These are sort of more geometric schematics. So they're helpful to not get caught up in the details and remember what the larger moves are, what the larger shapes are. So you could certainly copy any of these too. If you decide you would rather copy these, you're welcome to do that. I just want it, the thinking in the drawing to be, you know, these are a good source like the Rachet plates. So if you'd rather do this style, that's fine. It kind of lends itself to a schematic approach. And certainly the Rachet plates, you don't need to get caught up in the nuanced curvatures of each shape. You know, you can see that these ribs and so forth are just simply described. You could do the same thing from the Rachet drawing, the Rachet plates. So I think in this folder, you would have the same options. I believe there's some plates of the pelvis, but I'm not seeing them. The skull and the thorax are here. Where's the pelvis? I guess you could just take it from these larger views, but maybe I can find, I know this book has plates of the pelvis. Anyway, so you can use these plates instead if you'd like. The main focus would be to study the terminology, but to start to get familiar with the construction while we're doing it. Any other questions?
Yes, Joseph, I don't have access to these files. Do I need to, I'm not sure how I can.
If we can't resolve that, I'll just email them to you.
Okay.
So I think Mary tried to invite you. That didn't work out, right?
Yeah, well, I got the hands. I just didn't know there was more on the drive. So maybe it was just I needed to send a Gmail email instead of my other email.
Because you only have access to that one folder, you mean?
Yeah.
I see. Okay, well, we'll try to resolve that. If anyone else has problems accessing these folders, we'll try to resolve that because we'll use these folders to be sharing stuff with.
So was that Allison talking?
Yes.
Yeah.
So Allison, I also find you do need to be on Google Chrome when you're doing your internet search. So if you're coming in on another internet searcher, Gage can speak this language, not me. Then yes, you got to be on Chrome, and you've got to go to having a Gmail account is very helpful. Yes, you have to have that.
What if I have it on an app? I just the Drive app.
That should work too, Allison. Like Belinda said, one of the probably easier ways is to use Chrome. Then you can just kind of see exactly what Joseph is showing here as well. But if you download the Google Drive, there's the same section, kind of like if we're looking at Joseph's screen on the left-hand side where it says shared with me. If you go in there, there should be in like a spot where you could access everything that he's seeing now.
Okay.
He's pointing at the shared with me right now with his little.
Yeah.
Right.
So actually, let me pull it up on my phone just to make sure that I'm not crazy.
My other question is, Allison, did she share just the hand reference or the student shared folder? Because that might be the actual problem.
Yeah, I was gonna jump in and say too, I actually need access as well. So if somebody could share that with me, that'd be awesome too. But
After that, I honestly don't know. And I honestly don't know.
Okay, so Gage and Allison and anybody else?
Trying to find out who's gonna do it, and most of them are still good to ship out this month.
You sent me the student shared.
But at the same time, I told Troy in my text that I said,
Okay.
I don't know. They're all the ones that are answering are saying.
So I open up the link that she sent me, which I think is the same thing as what I'm seeing, as what you have, but I don't know how to get it into, like, go to it normally. I don't know.
You don't know how to what?
So she sent me the email, and I can get into it through the email, but
Oh, you don't know how to get to it without going to that email.
yeah.
Right? Yeah. On my computer, I have it set so that I stay logged in to, I actually am not even sure. This page,
Allison, do you have access to a computer to do this, or do you only have your phone?
Uh-huh.
So it's easier on a computer, but if you go on the computer, you've got to enter the internet on Chrome, which is that ball-looking thing.
Yeah, okay.
Yeah, and then once you go in there, you have to go to the, there's like that little grid of 9 dots over to the right side of your screen. And you can choose, Google Mail or Google Drive, and it would be under the Google Drive, which is the triangle.
Okay.
It just gives you a whole bunch of accessories to play with. You're not in front of a computer right now, are you?
I am actually. I'm trying.
You are? Oh.
part of it might be too, Allison, like make sure you're looking in the like shared with me part too, because that's sometimes where, like, unless you put this student shared folder, like unless you save it to your own drive, you probably won't be able to see it unless you go into the shared with me part.
Well, first you have to get to my drive. Do you even have the triangle thing with the drive? It says drive on it.
I have it on my phone, and I just went into Google Chrome and typed in Google Drive.
Uh-huh.
But
Well, you don't have to type in drive. There's these little, see the little circles? There's like a grid of 9 of them over to the right side of your screen at the top. There's 9 little dots.
I'm just at the sign in part,
Mm,
and I tried
right.
signing in with the email that she sent. It sent me the folder to, and it won't sign in.
So do you have a Gmail account?
I do, yeah.
So you have to sign into Google first, and then you'll be able to see your email. But you should also be able to see your Google Drive. It's another option besides mail. So you have your own you gotta get your own password.
That Gmail account and everything set up in Chrome, Allison, then they can just forward you this same thing again, but to that email. And that should kind of streamline, I think, a lot of the issues that are kind of happening. Google's like kind of funny that way. They're very like symbiotic in their own, kind of universe. All their stuff works really well together. But then as soon as you start going out to like MSN or any other, kind of internet or email provider, it can get kind of jumbly. So
Okay.
I would just say, like, set up your Gmail account and everything like that, and then give that to Joseph or whoever is going to send you the links or access to us, and then that should be a little easier kind of moving forward after you have that all set up.
Okay, so I do have a Gmail account. So, and I logged into the Drive with that Gmail account. So should I just give you that email?
You'll have to send access to that new account.
Okay. So
Is that what you're gonna do, Gage?
Joseph, if you can send me that as well, to my email, that'd be awesome. And then I can get access to this too.
Okay, your email is a Gmail account as well?
Are you talking to me?
I was talking to Gage. Is yours a Gmail account? Well, we'll figure it out. Anyway, anything else? I just posted the Rachet plates of the skull that are labeled that weren't there when we were going through this. So these would be maybe a good standard for the terminology, how much terminology of the skull. And you could use these to draw from as well.
Joseph, sorry, my headphones died, so I was like answering and it wasn't picking up. My email, yes, is a Gmail account.
Okay, good. All right. Okay, thank you everybody. And I'm still figuring out a lot of this stuff I have these videos that we've recorded our recent lectures with, have to be compressed and then posted, and I'm sort of in the middle of doing that. Steve may be helping me in order to finally get that online, but that'll be forthcoming soon.
Okay.
As well as the stuff I'm recording in the future. So.
Okay, that's
right.
great. Thank you so much.
Okay, thank you.
Hey, Joseph, can you just tell us what's next? Are you doing a lecture on Monday or
So I'll be posting my lectures and I'll let you know when those are posted. Michael, I think, is planning on Monday for his. Yeah, so Michael will be lecturing on Monday at 1:30, and I will let you know when I have my own posted, and then we'll probably do a similar kind of time, midday, for discussions once you've had a chance to watch them.
Okay.
So the next thing would be Michael's lecture on Monday at 1:30, and then if you can get your homework, be working on that so you can post that Tuesday and Thursday, that'd be great.
Thank you.
Okay, awesome. Thank you so much.
Hey, thank you.
Thanks,
Thank
Joseph.
you.
Okay, bye.